Joining me now for more from Reading, England is Simon Clarke. He's a cellular microbiologist at the University of Reading. Thank you so much for joining us on the program. Now,
Good
what
afternoon.
do you think the main cause of this, as they describe it, the fourth wave of the COVID-19 pandemic happening in Europe? Does it come down to vaccination rates?
Well, I think what's driving it really is the fact that we're moving seasons. We're moving into late autumn, early winter, and of course, we're in a different situation to where we were last year because there was no vaccine this time last year, and we're moving into a situation now where there is some. So the virus is as it grows because of winter conditions and people spending more time indoors, probably, then it's able to find out those people who haven't been vaccinated or for whom their vaccine immunity is beginning to wane.
Right. So you do think that obviously our immune systems are a bit weaker during the winter, hence the spread of the virus is increasing during the season.
Well, your immune system can be weakened by less daylight, poor food, feeling just generally a bit under the weather, but also spending time indoors more. And the cold weather perhaps possibly makes our respiratory tracts a bit more susceptible to infection. But it's quite common for us to experience increased rates of respiratory tract viruses during the late autumn and winter.
Definitely. Now, Austria, I want to give them as an example because they've put all unvaccinated people under lockdown in one of their recent restrictions in combating the virus. How much do we know about the spread of COVID among the fully vaccinated people, whether it be in Europe or elsewhere?
So a fully vaccinated person can still get infected, although they're less likely to get infected than somebody who's not been vaccinated, and they can have a peak, a maximum quantity of virus in their airways, which is again very similar to somebody who's been unvaccinated, but they have that for a shorter period of time. So there's that factor to take into consideration when they might be able to spread it onto somebody. They're sort of peak secretors of the virus for a shorter period of time. But of course, they're less likely, as I said, to get the virus in the first place, a vaccinated person. So if you don't get it, you can't pass it on to anybody else. So there is some nonsense doing the rounds that the vaccine doesn't stop you passing it on. Well, it does stop you getting infected or reduces your chances of getting infected in the first place.
All right, Simon Clarke, thank you so much for joining us on the News Hour. It was a pleasure having you.